Thank you, sir, for the kind introduction. My task today is to talk on current curriculum and its challenges. I'll just touch on the performance of our graduates, the current curriculum. Because it is challenges, I thought of giving the internal challenges and external challenges. So these are the little topics I'll be touching on during my. So if you look at the merit order, the island-wide merit order, the performance of our Jaffna graduates in the first 50 has recently, we can see over the last 5 years, we have come down in the numbers, even though we were performing very well in the previous years. The common merit list doesn't really reflect the performance, but that is the criteria that we are using at the moment in Sri Lanka. So it is a little worrying to see our graduates' performance a little bit deteriorating now in the recent years. So if you look at the current curriculum, we have four phases. Actually, recently only we have changed the curriculum over the last few weeks into 3 phases, where we have combined the 2 and 3. So in phase 1, what they do is learn the basic sciences in the synchronized way, as Professor Sivapalan said. But still, we are having segregation into anatomy, biochemistry, and physiology. When they move on to year 2, 3, and 4, they have the phase 2, where they learn more of the disease spectrum, and at the same time, they have the clinical rotations. They are in the hospitals during the morning hours from 8 to 12, and in the afternoons, they come to the faculty for lectures. So what they are supposed to do is to learn the clinicals in the morning and reflect on that and adopt the basic understanding by following the lectures in the afternoon. But at the end of this year 3 and 4, we have an exam. Actually, we have shifted this second phase examination to the end of 4th year. So they will have all 6 subjects at the end of 4th year exam, and also we have recently introduced the OSCE exam, a common OSCE exam where all 4 clinical specialities and 2 stations in psychiatry and 2 stations in community medicine will be included. So it's a 20 station OSCE, which is we had a trial last year. This year is going to be a proper one somewhere in November or October. And after that, it is a barrier to enter into the final year. So when they come into the final year, they do medicine, surgery, obstetrics and gynecology, pediatrics, and from last year we have introduced the psychiatric component as well. And then they do the final examination, which is a common exam in MCQ, true, false, and single best answers, the structured essay, and the clinicals. But the clinical assessment is still traditional, having long cases and short cases. And some of the subjects, medicine and pediatrics, have the OSCE in the final year as well. So if you look at the SPICES model, our target is to get the students back onto more student participation and control. But we, as a traditional curriculum, moving towards integration at the moment, having synchronization, are still mainly controlled by lecturer participation and control. So that is where we are integrated curriculum with more teacher control, which we will be shifting more towards student participation in the future.
So that probably somewhere where we are at the moment. So that is basically because we are struggling to go into this student control learning, because it's in our blood that we have to listen, as you heard Professor Sivapalan saying, the Guru Sishya learning technique. That has incorporated us in our genetics, I think. So what we want is mainly we need information from our teachers. So that is the greatest challenge I think what we have is the learning style. Learning style is mainly we don't want to go into the learning experience, but we expect our teachers to tell everything to us. From grade 5 scholarship, it's something like the 11 plus exam in the UK. So it's from grade 5 to GCO level, GCA level, and then coming on to medical school, they still expect the teacher to tell everything rather than them going and learning on their own. So that is the big challenge we are facing at the moment. So I've just done presenting a survey done using the DREEM among the final year students at the current final year students just before the presentation. So that if somebody doesn't understand what DREEM means, DREAM is a Dundee Ready Educational Environmental Measure. This is a standard measure which is used by world over to assess the environment, student learning environment. So overall score, the students are more positive. Attitude is experienced by our students, almost 65%. And then if you look at the student perception of the learning environment, they say it is a more positive perception, which is very good. Teacher is viewed negatively by some of them, but highly thought of is in the minimum range. So if you look at the student perception of the atmosphere, what they have said is about 48% say that there are many issues which need changing. A more positive attitude has been also told by some of the students. And the most important thing is the social self-perception. You can see not too bad and not a nice place. Even 45% of the students have said that it is not a nice place, and not too bad by a few, and very good only about 10%. So that we move on to the next one as the challenges. So I'll just talk through the internal challenges first. The curriculum as per se, the increased workload is mainly the major challenge that we have facing. So the students feel that they are a small fish in a large pond. Knowing what information is useful is what is very difficult for them to understand. That is mainly because of the learning style they have gone through. So it is knowing what is important, and what is important, we need to tell them what is important is what I feel as a major challenge. And we also have a very tight structured program. Earlier we had a lot of gaps in between. Now we are planning to finish off and almost timely finishing some. So we are even finishing before some of the other faculties. So that has tight schedule of the structured program, whether they have enough time for self-study is the other challenge. When you consider the teaching learning methods, we are still mostly based on the traditional. Are we ready for a change? We are ready for a change, but how are we going to achieve that? But we need to go into and do this mainly to help these students. So more of classroom-based learning is what we are doing at the moment. We haven't really gone into the web-based Moodle blog or nothing. We are not doing it at any point, but recently I am happy to say that we have gone and recorded few lectures by Professor Somasundaram to go on to the web. And less of problem-based learning. Even though they go and learn the problem-based, have sessions in the problem-based learning in the clinicals, I would prefer they have get some exposure into this problem-based learning earlier on in their career as well. So that we need to introduce more problem-based learning sessions. We have actually introduced this problem-based learning over the recent years or rather recent months to have few sessions on problem-based learning. Then the major challenge we face is the assessment techniques. Especially in the clinicals, there are a lot of new techniques that we use in the, I think Professor Gominda is going to talk about that. So new techniques are there, the work-based assessment as Professor Daker's talk from yesterday, and the skill assessment. So we have introduced this OSCE to assess skill assessment to some extent. I feel that we need to introduce more of these type of assessments earlier on itself. And the other thing, the curriculum is having very limited time. In vacation time is very limited. They have 1 week New Year, 1 week for New Year, 1 week for Christmas, and the study leave that they get before the exams. And out of bounds when they have the final year. So they have very limited vacation time. So that is promoting them to cut classes and go home. So that is also a major challenge for us. If you move on to the teachers are overworked and exhausted. So because of this, both the faculty staff as well as the extended faculty means that the consultants in the hospitals, they're all overworked and exhausted. So because of that, we have the participation on change and dedicated and motivated teachers, the number, and that is also a challenge, and we feel that we are not really doing something to accept the change. That is the other thing that the Jaffna man finds it difficult to attitude to accept change. Teachers as well as the administrators find it difficult to accept change. So that's a real challenge for the whole process, the attitude to change. And the courage to try out new innovative ideas. If you want to move forward and match the world, we have to have the courage to try out new innovative ideas. That is, we don't have that courage. Even if we do something, somebody will say, that's not right, or put you down. So that's what I think we lag behind as well. And the involvement of continuing medical education is also a problem. When you take the faculty as say, the lack of manpower is the major problem, both in the academic and administrative aspect. That is one of the major challenges, and we have still got several cadre vacancies. The infrastructure, incorporating modern technology. As we are in the process of developing modern technology. We have IT laboratories and all these things, but the skill development, skill stations, and all these scenario teaching skill labs, we don't have those things. So modern technology is lacking behind. And the other major lack we have in this area is lack of research. We have a fresh population which has never been identified, which has never been analyzed. So we can have lots and lots of research can be done in these areas, but we don't have enough supervisors, enough laboratory facilities and funds. And the other major drawback is how are we utilizing our available funds? How are we utilizing? Are we really utilizing it in the correct venues, correct way? Is it a challenge as well? And then the capacity building as well. We do not have much opportunities to go out and explore the world and come back because we are overworked. There's only one man doing all the work, and that person cannot take the leave because of the problems we have. So that's again a drawback and a challenge. So if you move on to the learner is the student who is the main partner in this whole process. So they have an attitude change. Nowadays, the students are always geared to passing exam, earn to gain societal reputation and economic prosperity versus skills to treat and solve problems. So earlier we used to do that. Nowadays, it's mainly passing exam. And then they have this lack of critical thinking. They expect spoon feeding. I always tell my students, even when you're spoon fed, you use your mouth to munch the food, but nowadays they expect you to nasogastric tube feeding. So that's one they have to change, the lack of critical thinking. The willingness to learn is another problem. Lack of communication skills, especially when you're communicating to the patients. Parents, because I'm a pediatrician, I'm talking about parents, but patients and colleagues, nurses, your other allied health professionals, you don't know how to talk to them. So that is a big problem. And nowadays, language barrier and support from peer group, peer-assisted learning is the other major problem. And then we do have moral and service-mindedness, respect to other professionals is also a problem. If we move on to the external challenges, the knowledge and technology is fastly growing. So we have to change according to that. The growth of knowledge, advanced technology, the disease spectrum is also changing. So we need to move towards those things as well. So when you take the individual, the expanding subspecialties, recently we have a vitreoretinal surgeon in Teaching Hospital Jaffna. So this is kind of very minute subspecialties which are coming up in the PGIM recently. So that is a different challenge as well, and also the importance of lifestyle issues which have changed, and we would like to, it's also a challenge. So if you take the society, aging population and female population is increasing around Jaffna and the northern region. The disease is different spectrum, different preventive measures, expectations of other healthcare stakeholders is a questionable mark. And also everywhere we have the same problem, the socio-economic factors and political influence that is also considered as an external challenge. So that's all I need to tell you about. So challenges are what makes life interesting. Overcoming them is what makes it meaningful. Thank you.